This is the presentation for head and neck. I am Natalie, the nurse, and this is Brian, who is going to be the patient. Thank you, honey. Okay, first, now that we've gone through your history, I'm going to examine your cervical muscle strength and cranial nerve 11. So the first thing we're going to do is I'm going to have you, I'm just going to take a look at your head and neck. If you can just stand, sit straight. Head and neck, head is erect and still. Good. I'm going to have you take your chin to your chest. Yep, and then back up. Perfect. And then move your head to the right and then to the left. Good. Ear to shoulder. Yep, and then the other side. And then tilt your head all the way backwards. And then back. Okay, so he was able to perform that smoothly and controlled. I did not see any swelling of the salivary or lymph glands when he did that. Next, I'm going to place my hands on your shoulders and I want you to shrug. I'm going to use a little bit of resistance here. I want to see if you can push my hands up whenever you're ready. Okay, good. And then you're going to I'm going to put my hand up to your face and you're going to, with resistance, I want you to try to push my hand away. Good. Now the other side. Perfect. So he had appropriate strength noted on this exam. Next, I'm going to examine your lymph nodes. I'm going to use the pads of my fingers, and we're going to start with pre-auricular, which is right here in front of your ear. The second one is post-auricular, which is right behind the ear. The third is occipital, a little bit lower than that. Fourth is going to be submental, which is right under the chin. 5 is going to be submandibular, which is right here. 6 is going to be jugulodigastric, which is a little bit right there. 7, superficial cervical, which is going down here. 8 is the deep cervical chain. I'm going to have you turn your head this way while I palpate the side, feeling for any enlarged lymph nodes. And have you turn the other way. Then I'm going to feel here to feel any enlarged lymph nodes. I can feel that. I have him turning his head so that he can relax the muscle, and I can search for those nodes. I don't feel anything there. And then 9 is going to be post-cervical. So we're going to just keep moving down the neck. And 10 is supraclavicular, which we've moved down the neck. We've palpated for enlarged swelling lymph nodes, is going to be right above the clavicle. Again, I do not feel any enlarged or swelling lymph nodes, so my assessment here is that this patient has, I'll ask him, did you have any tenderness when I was pushing anywhere?
None.
Okay. I did not feel any enlarged lymph nodes present. Patient denies any tenderness. The last exam I'm going to do is I'm going to examine your thyroid. What's easiest to do is I'm going to have you tilt your neck all the way back. That way it's easiest for me to feel your thyroid. So I'm going to try to palpate it. Hard to palpate. I'm going to have you bring your neck back up. Take a sip of water. And I'm going to watch as your thyroid goes up and then back down. I'm going to have you tilt your head all the way back. Okay, and I'm feeling here. And I do not feel any enlargement at all. Thank you, sir.
You're welcome.
I'm saying that my assessment, the thyroid is not enlarged, and that should conclude our assessment. Thank you, Brian.
You're welcome.